Hello, and welcome to this week's edition of The Authentic Physician, a show about ambition, identity, and health transitions high achieving women are rarely prepared for. If you're juggling leadership, caregiving, and a body or a head that suddenly has its own agenda, you're not alone. Here we have honest conversations about medicine, midlife, meaning, and what it takes to lead without losing yourself. It's not about perfection, it's about alignment. And today I am so excited that we have with us Dr. Nancy, who specializes in things on our head, namely our hair. And ladies, this is an important part of who we are, gentlemen too. But Dr. Nancy, thanks for being here. Tell us a little bit about
Welcome.
yourself and how you got into the wonderful world of hair.
Okay, that's a loaded question.
I know,
Anyway,
right?
thank
So
you
have
for
fun with
having
it.
me. Thank you for
You're
having me.
welcome.
My name is Dr. Chefu, Nancy Chefu, like you already said. Trained in internal medicine, and emergency medicine. So actually, working in the emergency room had a whole lot of stress in the emergency room. I was the lady or I was the physician that changed her hairstyle every week. Like if you were looking for Dr. Chefu, you would look for the lady with the new hairstyle. That's how they always recognized me back then. So anyway, I dealt with hair loss from all the traction, all the, stress, especially for ladies. One thing that tends to show up with chronic stress is hair loss, hair thinning, hair shedding. We don't know it, especially people ladies, high functioning women that come to my clinic. Stress is always number one. For men, once they come to my clinic, I already know they're dealing with one form of genetic, hair loss, and the treatment is straight really easy. But for women, I have to really sit down and go through my A's, B to Z, because
Mm.
there's so many causes of hair loss for women. So, and that was my case. And why did I open my clinic was because of my own issue of hair loss. And I went to several clinics for hair treatments, but I tend to find that either you're going to a a dermatologist, and they're prescribing medication for you, but you don't have the option of hair transplant. So sometimes you need hair transplant.
So let's say
Now,
that again. Hair transplant.
yes,
I'm
for
all in.
women,
Tell me
yes.
more. For women, tell me
So
more.
for women, yes. So you can also go to a hair transplant clinic, but what they offer is only hair transplant. So that's the problem. So Havila Hair Restoration was open to bridge that gap between medical treatment, non-surgical treatment, and surgical treatments.
Got it. So if I mean, my clinic, I'm just thinking of the people I
Mhm,
serve, high functioning, ambitious women
mhm,
across all spectrums. And, they're either postpartum and their hair's falling out, or they're perimenopausal and their hair's
mhm.
falling out, or who knows, but their hair's falling out. And
Yes,
it's distressing, right?
yes,
Legitimately distressing. And they'll
yes.
have these, I've never had thick hair. So this is always
Mhm,
shocking to me when I look at
mhm,
them and they're like, at least half my hair is gone. It's falling out in clumps in the shower. I'm
mhm,
like, you look like you have a lot of hair, right? Like I'm
mhm.
jealous.
Yeah,
But for them, it's not their normal.
yes, it's
You see
not.
that all the time.
So yes, and that's the way we describe it. What is hair loss for you is not what is hair loss for someone else. Like you
Yes.
said, they might, they might, let's say 5, 10 years ago, they used to have gorgeous hair. But
Hmm.
now for them, they're actually distressed because of their hair loss. To you,
Yes.
you're looking at their hair like your hair looks beautiful, it looks gorgeous, but to them, it's not.
Yes.
So you
Yes.
can define hair loss based on your own perspective. So
Mm.
that's why everybody is different. Every case is different.
Makes so much more sense. So tell us when it comes to hair, first of all, I would imagine some women find you on their own, but probably
Yes,
some are
yes,
referred to you.
yes,
So you go through and you figure out, does this bother you? What do we think it's from? Have you had the medical workup?
yes.
What's the next step?
So the way I go through, I'm going to go through my consultation. So when someone comes to me, makes an appointment, I want to know, have you seen a hair loss specialist or have you seen a coach? Have you seen a dermatologist? Have you seen a trichologist? Who have you seen?
Mhm,
I want to know all the lab tests you've done.
mhm.
I just want to know the background because that's where I'm going to start from.
Yes, that makes brilliant
You see,
sense.
I'm not going to order blood tests. If you just had your regular physical exam with all the blood tests, I won't do that.
Right. Well, there's no point, right? You're not gonna
Yes.
waste their money.
Hmm.
So then when people work with you, are they only local or do they come from all over the
They come
country?
from all over the country. It depends. And that's why we have free virtual consultations 7 days a week.
Okay. I'm
7 days. So
thinking
it doesn't matter
there's
where you are.
I'm thinking there's a trip to you in my future. 'Cause,
I'm
um,
here.
I've always had thin hair, right? I didn't mean
Yeah.
this to turn this into something about me, but I think there's a lot of women who might identify with what I say,
Mhm.
where de regardless of what hair you've had, you're getting the widening part,
Mhm.
you're getting the scalp that seems to be receding,
Mhm.
and you're going to your doctor and you're feeling a bit blown off,
That's right,
and
and that's the issue.
that is an issue.
And let me tell you something, every physician I've spoken with has never seen someone say, "What do," like, when you ask people about their medical history, past medical history, I've never heard someone say hair loss.
That's true. That's
Have
true.
have you ever heard someone say alopecia as part of their medical No.
Right, right, and I've noticed that. So I treat a lot of women in transition, and so I'm a little bit in tune to some of this, but some of the things you were talking about before the show, I think you said microneedling, if I'm not
Yes, yes,
mistaken.
yes, microneedling.
Those are just not things I regularly hear even my dermatology colleagues
Mhm.
talking about. So I have a patient, a male patient, who
Mhm.
has done amazing things with his hair, and I think his was more, and you're going to tell me the right term, but it was like a tattoo where it looked like there was little hair follicles.
Scalp micropigmentation, SMP.
Got it. So he did that and he loved it, and he was, like, encouraging me to tell everybody about it. And that's great, but, like, for women who want to have longer hair and their ponytail is, like, the finger size of their pinky now when it used to be their whole wrist, like, it is legitimately a problem. So tell me, as a doctor and then as a
Mhm.
patient, like, who do I refer? As a patient, what questions do I ask? I'm asking that for our listeners, but how do we get to you?
So
How
the
do we know
question
we need you?
Okay, let's go back a little bit. You talked
Please.
about one of your client that talked about the treatment. So now
Yes.
why that is dangerous for you to just recommend the treatment is that it's
Yes.
not actually a hair loss treatment. It's a scalp coverage treatment. So what
Mm.
happens with hair loss when your hair is thinning, your
Mhm.
scalp is more visible.
Yes.
So if what I'm thinking what he did was scalp micropigmentation is almost the concept of tattoo,
Yes.
shading of the scalp,
Correct. That is
giving you
exact
an illusion that you have hair.
yes,
But it's
that
not
is
a
correct.
treatment for hair loss. Because why it's dangerous is that if the person is not on the medical therapy for hair loss, you are gonna keep losing hair, and then that tattoo or the ink is gonna become visible, and that's what I tend to see in my clinic.
Boy, we don't want that.
And we don't want, and now I have to cover because you need to use laser to erase it,
Mm.
and that's the problem.
Oh, tell us more. Keep teaching. You're doing great.
So that's why it's dangerous to just recommend go for scalp micropigmentation. Actually, for my female clients,
Uh-huh.
if your hair loss, if your frontal and your edges, if you're having hair loss, your frontal
Still
hair
here.
loss and edges, yes.
Okay.
I do not recommend scalp micropigmentation.
Okay.
Why? Because that is a trick. They tell you it's gonna look like your hair. Remember, always remember that hair loss is progressive, and if you're not
Uh-huh.
on the right medication, imagine if your front hairline keeps thinning, you now have
Right.
that line between the ink and your hair.
It's like a bad tan line in the
Bad
wrong
tan line, and
yes.
this makes a lot of ladies depressed because you want to put your hair in a ponytail,
Right.
and imagine you then see
Uh-huh. Yeah.
the black is usually it turns from black to dark blue
Oh my gosh.
with
Yes.
time. So imagine, and you look it strange,
Mm.
awkward, and no, 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 don't do it.
Just
Don't
no.
do it. No, no, no. You need a proper hair and scalp evaluation.
Okay.
Now, we also do it in our clinic, but there are strict recommendations that you have to follow
Okay.
before we do that.
So, what I love about what you're saying, first of all, you had me when you started talking about hair. Like, that's like my nemesis my entire life. But the other part of what I'm thinking is how many times it is easy to get tricked
Mhm.
into marketing, right?
Yes.
Or you do see someone who's really happy with the result that they got and they don't know that they're on that pathway you just described.
Mhm.
And certainly, I don't know any lady who wants the pigmentation changes in her
No.
forehead or scalp turning black to blue. That would not be cool.
Yes.
Let alone it wouldn't look right on someone with a different skin
Yes.
hair color,
Correct.
obviously. But I'm curious a little bit in terms of what I like you saying, let me back up there, is I like you saying what I'm hearing is get to the bottom line. What's
That's right.
underneath? What's the
Mhm.
root cause?
Mhm.
And so then I am curious because everyone And of course, Facebook says that I need Nutrafol, right? So I tried Nutrafol for 6 months. I was like, this is not working. And I wasted all that money, right? But some people swear, I have clients who are like, you cannot take this away from me. And I'm like, but it doesn't work. And they're like, I don't care. I'm going to take it. Okay, I guess it's your money, whatever. But what's
Mhm.
the evidence about that? What do you see in real life?
So I don't have anything against Nutrafol, you know, but it's not going to work for everyone.
Hmm.
Like I'm saying, for ladies, we have more than 200 causes of hair loss.
200,
More than 200. So
more than
one
200.
so one person can
Really?
have two or three things causing their hair loss.
Now, why did I not learn that in medical school?
But that's why you come to me. That's you
That's right.
see?
That's
That's
right.
why you come to me.
More than 200 causes of
More than 200. Someone can have traction from those ponytail. Somebody
wow.
can be pulling their hair because of stress.
Mm.
You see? And now you're having the genetic factor in it. And
Mhm.
now what if you just gave birth? You now
Yes.
have shedding, which is a
Yes.
period of stress.
Right.
So you imagine I've already counted five.
Just in that.
So
Gosh.
just taking Nutrafol
Yeah,
is just one part of it.
that makes
It's
so
not
much
the whole complete picture.
I'm still, like, stuck on the over 200 part.
Yes, over
Like, if you
200
told me
part.
there were over 20, I would, like, be
No.
overwhelmed, and you're saying 10 times that.
And that's why in my clinic, we don't just follow clients for just one day. There's a actual agreement there. You have to come to the clinic for 1 year, 12 months.
And so every month do they come, or how
No, not
often?
every month, maybe
Okay,
3 months, three to
every
six
3
months.
months. Okay, over that
Sometimes some
period.
people can come in every month. It depends on there's different hair packages, depends on which one they get.
Got it. Got
Yes.
it. It's
hmm
fascinating.
Yes.
Okay, so then here's a question because
Okay.
I actually like my pillowcases, so I probably won't change unless you tell me to. But I've read that different types of material that you sleep on can
Yes.
impact hair. Is that true or is that nonsense?
Yes, it can impact hair. But like I said, you can have five things causing your
20
hair
more,
loss.
right?
So,
Right.
but I want people to understand the concept of the the pillowcase and all that. It's not about the pillowcase, it's all about traction.
Okay.
So whatever you do that causes traction to your scalp
Mhm. Mhm.
is going to give you traction alopecia, which is hair loss from all the pulling.
Got it. So every day I put my hair back because I hate it in my face. And is that why I'm getting the breakages?
That can also be part of
Oh,
it.
good grief. That's not what I wanted you to tell me, but okay.
I
This
have
is
to.
I appreciate it.
You're welcome.
I'm telling you, I need to, like, figure out how to get to where you said you're somewhere in Georgia, right? Where are you
Yes,
at?
Peachtree City, Georgia.
Yeah, I have a feeling I'm gonna have to come see you
You
because
have to.
this is worth a flight to me. I am
Okay.
so bothered, and I don't know about the other ladies listening, but, like, it really has always bothered me that I had thin hair, and
Mhm.
it's just gotten worse in my 40s. I'm like, "I'm gonna be bald soon, right?" I guess I'll rock the baldness or I'll come see you and you'll solve the problem. Those are my
No,
choices.
but what I say is that it's okay to be bald if that's okay with you.
If
Like,
if that's
no
okay with
judgment.
you.
This is a no judgment zone. So if you
Yeah,
don't want to be bald, that's okay. Rock it, girl.
exactly,
Put your
exactly.
lipstick.
I'm
Come
not
on.
sure I'm there yet, but, maybe. My husband rocks the baldness, but, I think I might need a little more padding on my scalp. So, tell me then, I wanna be respectful of your time because I know we have to let you go, in a few minutes. Are there beliefs that women have around their hair that you're like, "Girlfriend, that's crazy. Stop thinking like that."
Yes, there's a lot of stigma to hair loss for especially women. Some women believe that hair transplant is not for them. They feel is a lot that is an aggressive treatment, but sometimes that's all you need.
Okay.
That
If
hair
you
transplant.
if you have a hair transplant, are
Mhm.
you using your own hair or someone
You're
else's?
using your own hair.
Okay, so you use your own hair. Do you
Mhm.
like with organ transplants, you have to take immune suppressing meds. You have to do
No,
that
you
for
don't need to.
yeah,
No, no, no,
okay.
no, no.
And so is what scares women about it? Is it the cost, the intensity of the treatment, or something different?
The
Maybe all.
first reaction I usually get is, I don't think I'm that bad. Like,
Oh,
because they only feel is for men.
got it.
But I'm
Okay.
like, sometimes that's just what you need. You see,
Yes.
especially women that have been on medical treatment, they're on Nutrafol. I'm like, hey, you've tried everything. Right now, your head needs more. Your hair needs more. You see, you just needed to give it that push a little bit,
Got it.
to get that density that you're looking for. Sometimes you can try all the treatments you want,
Uh-huh.
you will not get the density, which is the thickness you're looking for. So what will help you?
Mhm.
With that thickness you are looking for is a hair transplant. But the good thing about being on medical therapy before the hair transplant is that, let's say you need 1,000 pieces of hair, strands of hair to cover the area of baldness. Now,
Okay.
if you're medical therapy, it can help you gain 30%.
Okay.
So you might not end up needing that 1,000 pieces. You might end up needing half of that.
Got it. And by medical therapy, you mean prescription medicine?
Prescription, yes.
Okay.
Minoxidil, finasteride, it depends, spironolactone, it depends on which one that, you know.
Okay. Interesting.
Mm.
And do people generally have to take medicine a certain amount of time before they know that you've so-called failed medical treatment by itself?
No,
Okay.
no, no.
So if I have someone on it for 3 months and they're not happy, I can refer and
Like I said, yes, it depends on what, like I said, it depends on your goal. What do you want?
Mhm.
Sometimes you
Okay.
can place people on medication and their hair loss is really bad. We do the hair transplant. As long as you're going to be compliant, adherent to your medication, do what you're
Yes.
supposed to do. We can go ahead. People that come from out of state, people that come from out of the country, like, we
Mhm.
can do hair transplant as long as they know what they're supposed to do.
Okay.
Yeah.
And then tell us a little bit about what type of care happens afterwards. I know they're seeing you, but what are they having to do in their daily life because of this transplant of hair?
About a hair transplant. So we have a post transplant care, aftercare. Why actually aftercare is very important is that we give you day to day what you need to do. Like we
Uh-huh.
have our day one,
Okay.
day two,
Yes.
weeks, first week, second week, what you cannot put on your scalp.
Okay.
Literally every question you can think. I tell my clients, if you don't see it in your aftercare, do not do it.
Ooh, okay. So you're very clear on what the
Very,
requirements
very,
can
very
be.
clear. And they sign the document. We go through it before the hair. No, you just don't read it. We
Yes.
go through it
You
because
have
I
to
needed to
understand.
ask questions.
Yes. Okay.
Mm.
So I'm curious on your
Yeah.
document with something like if I go to the pool, I probably can't be in chlorine, I'm guessing. But can I wear a hat on my head to protect my little bald scalp that just got transplanted?
Now, you cannot swim
Okay.
the first, let's say the first 24 hours. You just need to rest, drink
Mhm.
water, mind your business,
Yes.
hydrate,
Okay.
Netflix and chill. Then you have to gradually ease into things.
Okay.
After a week, recommended time is a week. After a
Okay.
week, some
A week's
places
not
can tell you 2 weeks, but by a week, your scalp skin is already healed, it's already closed.
got it.
So,
A week is really not bad,
yeah.
right? Like
Mhm.
it's not. So wait a second. If you're making these little cuts in someone's scalp and you're putting a hair in it, there's not a hair follicle there, right?
Yes.
So does the body create a follicle around this new
No.
area
So
or will it
let's
fall?
no. So let's imagine you're gardening. What do you
Mm,
do when you garden?
dig a hole, pull
Dig
the
a
weed.
hole.
Yeah.
Pull the weeds. Then you plant a new tree with the roots, right? Or
Yes.
seeds, whichever,
Yes.
whatever you're planting. So it's the same thing when we first of all go pull the good hair at the
Okay.
back of your scalp.
Uh-huh.
Then after we finish pulling out the good hair, we look at it under a little microscope, make sure it's good.
Yes.
Then we go to the front or the area of hair loss. We make
Uh-huh.
incision.
Yes.
Then we transplant it.
Okay.
So it's just like gardening. If you think about that concept, that's it. So
Yes.
it comes with the roots.
Got it.
So
So
it grows.
it grows and then the place in the back just grows new hair.
So no, it doesn't grow.
No.
Remember, you're pulling it from the roots at the
So
back
we're taking the follicle area with it.
with it.
Okay.
Yes. So
Okay.
remember that that's why it all about calculation. That's why um hair transplant, you have to go to a really good skill matters. So
Mhm.
it's not just a random, let me just go get a hair transplant. That's why we see a lot of bad cases because
Okay.
they can take all your good grafts in one location and they'll
Oy.
give you a big patch, like,
Okay.
a bald patch. And
Yes.
you don't want that. So with
No.
hair transplant, when you go to a skilled hair transplant, they know not to pull the hair from one spot. We
Okay.
randomly
Spread it out.
spread it out and we
Got it.
calculate it.
Interesting. There is so much intricacy to this.
Yes.
This is not something you learn
Yes.
overnight, and then you have
Hmm.
to practice, I bet, making all the right cuts in the
Yes.
right areas
And
and
it's
okay.
angles. You have to also watch the angles. I can't just look at the way you parted your hair. I'm not going to do a
Oh,
hair transplant and go and put the hair this way. No.
uh-huh.
So I have to
Yeah,
go with your angles,
got it.
directions.
Fascinating.
Mhm.
So, do you ever I am in a point in my life where I'm really trying to keep all the different toxins out of my life, and there's a whole lot of hair products, right?
Yes.
But where I'm going with this is I actually am starting to get some hairs that look my natural color, and then there's a space where they're white or bleached looking, like there's just no pigment in
Great.
that area. And then it goes back to natural. And the whole you can see it along the whole strand. I'm like,
Yes.
okay, so I'm starting to get gray. But does hair transplant help with that as well? Or is it am I gonna get gray at the same rate regardless of the transplant?
I think you're gonna get gray the same way.
Oh, that's not what I want you to tell.
But one thing I've noticed after hair transplant, most people tend to get grayer, have
Hmm.
more gray hair. So I don't
Hmm.
know if it's the concept is we're taking hair that is already trying to gray.
Mhm.
You see, so but I tend to have noticed that some people complain about they get more, gray hairs after
Okay.
hair transplant.
So
Yeah.
that's kinda something to know up front that could
Mhm.
happen. You're getting more
Mhm.
density, but it may be
Yeah.
gray a little faster.
Yes.
May not, but could.
Yeah.
Fascinating. So then you kind of mentioned already the harms of going to the wrong place.
Yeah.
Let's say somebody can't come to your location. How do they find someone you would consider a colleague to be qualified?
So they can go to ISHRS, which is the Organization for Hair Transplant Surgeons.
Okay.
The ones that have trained, that have
Mhm.
passed through the whole process of making sure that, they uphold the standards. Because
Yes.
I'm actually a committee member on that
Okay.
organization. Is a worldwide organization for all hair transplant surgeons. So no
Okay.
matter where you are,
Mhm.
country, state, city, just go to ishrs.org and put in your
ISHRS. Okay.
ishrs.org and look for just put in the city, the state,
Uh-huh.
the country, wherever you are. It will pop up
Okay.
all the list of hair transplant surgeons.
Excellent. Okay. Now, if I'm thinking about a transplant or referring someone for a transplant to you, are there certain things you want me to have lab wise done first? I heard you say you'd use labs, but I'm not sure that doesn't mean you wouldn't want labs first.
Now, every case, like I said there, hair transplant, I really don't need labs for hair transplant unless I'm thinking something else is causing the hair loss. Let's say in cases of inflammation, like scarring alopecia. So they might need to be on antibiotics.
Okay.
It's not going to be safe to do a hair transplant when there's an underlying
Hmm.
inflammation or infection causing the inflammation.
And the
So,
graft would fail, I assume, in that case.
yes.
Okay.
So it's
Interesting.
not about what you need to do. It's all
Okay.
about seeing the right person
Who
and the
will
right
know?
person knowing what to do.
They'll know what to look for. Okay.
They know
That
what
makes
to look for.
sense.
Yeah. So lab is only to guide you. I won't guide you on what you're really already thinking about.
Okay.
So
Very,
it's
very good.
not helping you to diagnose the problem. It's helping you
Hmm.
to guide, to tease out the other parts. Remember, I was telling you about 200 causes of hair loss. Somebody's
Right.
vitamin D might be low.
Yes.
Ferritin might be low. The person might be
Yes.
anemic. I've seen ladies that come in and ask them menstrual cycle, the heavy bleeders, and
Mhm.
their iron level is low. So you see,
Okay.
and they
Yeah.
don't know it. So it just helps me to guide me to tease out the other parts, what might be causing the hair loss before I proceed with a hair transplant.
Yes. Okay. So in our clinic, we see a lot of women who either need or take hormones and women who either need or take GLPs.
Okay.
I've noticed low estrogen and long term GLPs both. I see more hair loss in those
Yes.
women.
Yes.
Um, in that situation, like they're getting a benefit from the medicine, they don't want to stop it, and yet that may be one of the more than 200 things.
Yeah.
Is there still value in them getting a transplant or seeing someone, or is that going to negate the transplant if they're on these medicines?
No, it doesn't.
Okay.
The only thing we need to know is that if you're on GLP-1 medication, how aggressive is your weight loss?
Okay.
Because that can cause hair shedding.
At a
Hair
fast.
shedding is not true hair loss.
Ooh, say more about that. I know we only have like 2 minutes
Yeah.
before you have to escape.
Hair
So tell
shedding
us.
is not true hair loss. In hair shedding, you don't get baldness.
Okay.
Their hair is thin, you see there. They notice something, their hair is falling. But
Hmm.
you don't have true hair loss.
Which
It
would be
can it can worsen if you're already having hair loss. It
yes.
can make it more obvious,
Okay.
but it's not true hair loss because once that trigger is taken off,
Hmm.
you regain back what you lost. Did you get what
Okay,
I'm trying to say?
I
So
do.
let's say
Yeah.
if they are losing weight aggressively, you need to say,
Mhm.
hey, you need to take it easy.
Slow it down.
Or if their iron is low, or if the
Yes.
vitamin D is low. So there's always a trigger that shifts the hair cycle.
Mhm. Okay. That
I
makes
always
sense.
call it the lazy family syndrome. It's always just the lazy family that's sitting around waiting for something to push them out, push them out. So I call it the lazy family syndrome. So
Got
it's
it.
not true hair loss.
Okay. They were gonna fall out anyway, it
Yes,
just is
yes, we're gonna
okay.
fall. Yes,
Okay. Yeah,
because
that's helpful.
they were just resting in a ways,
They were just waiting to be pushed
waiting
out.
to be.
But that follicle's intact, so it'll
Yes,
regrow
yes,
versus there
yes.
being a true loss or a
True
scar.
hair loss.
Okay,
Yes.
got it. All right, you've, like, totally captured my interest. I'm gonna have to have you back another time, but I realize we gotta let you escape right now.
Yes.
How, you told us your clinic. Are you on
Yes.
social, or is there any other way you're
Yes, I am on social. I'm on Instagram, Havila Hair Restoration. I'm on YouTube, Dr. Chefu. And let me tell you something about my Instagram, my social media. I am the only hair transplant surgeon that talks to you like a, a client or a patient. I give you the tips and tricks on what to look out for, on what to do, on the right questions to ask your hair transplant surgeon.
Okay,
Basically, I give you the cheat code
love
on
it.
making the right decision when it comes to hair transplant, because
Okay.
that's what you need to make the right decision.
So, ladies and gentlemen who know the ladies who need this, make sure you're following on Instagram at a minimum
Yes,
and YouTube.
yes, yes,
We'll put those in the show notes. Is
yes.
there anything we haven't said that you want our audience to know?
I mean, I want your audience to know that I don't want you to deal with hair loss alone. It's a very lonely journey. Like, there's help. There's always going to be help. You just need to reach out, make an appointment. And we offer, and that's the reason we offer free virtual appointments 7 days a week. 7 days a week. I'm like, you need to just make the appointment. Somebody from my team will get in touch with you, talk to
Love it.
you, find out what you need. Then we
Yes.
go from there. Like, at least just make the appointment so we can
Right.
help. Yes, that's all.
Perfect. So make your appointment 7 days a week. There are teams available.
Yes,
I am excited to follow you and learn more for myself. I'm totally
yes.
being selfish on this, but this made my day talking to
Yes.
you. So
Thank you.
thank you for coming on and
Thank you so much.
giving so generously of your time and wisdom. And ladies, if something in today's audience resonated, you're not crazy. You're not
Yes,
alone. If you're feeling dismissed, that's real. Find and talk to someone who will listen.
that's right.
Deeper resources, next steps in the show notes. If you feel this helped you be seen, share it with someone else who can also benefit, who's navigating her own journey, hair loss or not. Because when we lead together, we lead better.
That's right.
Until next time on The Authentic Physician, bye for now.